Welcome back, everyone. My name's Corey Hammond, and I'm the Director of Prevention Services at Partnership to End Addiction. Today, we're diving into a crucial topic, understanding the different treatment options available for substance use disorders. When we think of treatment, most of us picture detox centers or rehab programs, but treatment is so much more than that. It's about finding the right combination of therapies to support an individual's recovery. Today, we'll discuss what treatment really is, what it's not, and the various paths available to help you or your loved one get on track. But before we get started, subscribing to our YouTube channel by clicking subscribe and ringing the bell is the best way to stay up to date on our latest educational resources and to stay connected to our community. First, let's clarify what treatment for substance use disorder really means. It's not just about detox, which only addresses the physical symptoms of withdrawal from alcohol or drugs and is therefore not really treatment for addiction. True treatment is a comprehensive process that looks at the person as a whole, addressing not only their substance use, but also their physical, psychological, emotional, and social well-being. The right treatment provides a strong foundation for long-term recovery and sets the stage for a healthier life. Treatment can take place in different settings, both inpatient and outpatient, and with varying levels of intensity. Each option has its own strengths depending on what the individual needs. So how do you know what's the right program for you or your loved one? Let's break it down. Let's go through the most common types of treatment programs available, starting from the least intensive to the most intensive. Counseling is often the first step in addressing substance use. It can be done on an individual basis, where a person meets one-on-one with a therapist, in group sessions where people share their experiences and support one another, or in family sessions where a person is joined in counseling by members of their family. Counseling helps individuals identify the root causes of their substance use, as well as their triggers for use, and helps them to develop coping skills to manage cravings and stress. It's ideal for those with mild substance use issues or those in the early stages of seeking help. Outpatient treatment is a type of treatment where clients attend therapy sessions while continuing to live at home. Typically, this involves up to 9 hours a week at a treatment center. Outpatient programs are great for people with a stable home environment and a supportive family. It can also be a good option for young people who want to stay in their usual school environment during the day, but might need slightly more intense treatment than just therapy twice a month, for example. An intensive outpatient program, or an IOP, is a form of outpatient addiction treatment which usually requires 10 to 20 hours of therapy a week. It offers more structure for individuals who need additional support, but still want to maintain their work or school responsibilities. Often they offer both morning and evening programming. This is also suitable for those with co-occurring mental health conditions like anxiety or depression. There are also special outpatient programs called opioid treatment programs for people addicted to opioids like fentanyl, heroin, and opioid-based pain medications. Formerly known simply as methadone clinics, today they offer therapy and a range of medications for opioid use disorder. Some might still require daily attendance, though, which can be challenging for people with transportation difficulties or rigid work schedules. Partial hospitalization programs, or a PHP, is a day addiction treatment program where individuals receive treatment at a facility for up to 20 hours or more each week, but in most cases return home at night. Some PHPs have a housing option, usually at an apartment or a hotel complex. This option is recommended for individuals who need a high level of support, but don't necessarily need 24/7 supervision. What comes to mind when most people think of rehab? Residential treatment involves living full-time at a treatment facility, typically for 1 to 3 months, though some programs can last up to a year. It's a highly structured environment designed to provide intensive support and help patients build a strong foundation for recovery. Inpatient treatment programs, usually offered in hospitals or specialized clinics, provide 24/7 medical and therapeutic care. This is often necessary for individuals with severe substance use disorders or co-occurring mental health conditions that require intensive medical supervision. It may also be good for people who have physical medical complications like heart disease, diabetes, or COPD. There are a range of effective medication treatments for nicotine, alcohol, and certain forms of drug addiction. Many of these medications can be highly effective in reducing addiction symptoms when used on their own, but treatment's typically more effective when medications are used alongside counseling and other therapies. Opioid treatment programs, formerly known as methadone clinics, offer treatment and medication options like methadone, Suboxone, and naltrexone, specifically to address opioid use disorder. Detoxification, or detox, helps a person manage their physical withdrawal symptoms. People with severe alcohol and benzodiazepine use disorders may need a medically supervised detox, where they're admitted to a hospital or a clinic for the time that they're detoxing. It can be really dangerous to detox from these substances without medical help. People with opioid use disorder might benefit as well. Still, detox alone is not treatment for substance use disorders. People with substance use disorder need treatment to handle cravings, cope with life's problems, and more. Try to encourage continued treatment if a loved one says that they're going to go to a 5-day detox and then leave right after. The time right after detoxing is a high-risk time for overdose, and it's really difficult to stay substance-free after only undergoing detox with no further help. With so many options, it can be overwhelming to figure out which program is best. Here are some key considerations to keep in mind when choosing the right treatment program for yourself or your loved one. Consider the severity of the substance use and any co-occurring mental health issues. Outpatient or counseling programs may work for those with less severe issues, while residential or inpatient care might be better for those who need more intensive support. If there are underlying mental health conditions like anxiety or depression, look for a program that offers integrated treatment to address both the substance use and the mental health conditions. Choosing a program that respects and understands different cultural backgrounds can greatly improve treatment outcomes. A culturally competent program acknowledges the unique challenges faced by individuals from diverse communities and tailors treatment accordingly. Evidence-based programs utilize proven methods and interventions that have been researched and shown to be effective. These may include things like cognitive behavioral therapy, CBT, dialectical behavior therapy, DBT, and family therapy, FT, and also motivational interviewing techniques. Choosing a program that employs these methods can enhance the likelihood of positive outcomes. If you're interested in a harm reduction approach to moderate use or stop use on one, but not all substances, look for programs that incorporate this philosophy. Harm reduction focuses on minimizing the negative consequences of substance use rather than solely aiming for complete abstinence. Counselors and some outpatient programs may offer harm reduction services, such as access to safer use resources, education about overdose prevention, and support for gradually reducing substance use. Is the treatment facility close to home? Transportation can be a barrier for many people, so consider how easy or difficult it will be to attend sessions. Some programs offer transportation assistance, or you can explore telehealth options if travel might be a challenge. Make sure the program is licensed and accredited by reputable organizations like the Joint Commission or the Commission on Accreditation of Rehabilitation Facilities, or CARF. This ensures that the program meets high standards of care. Family therapy and education can play a significant role in the recovery process, especially for teens and young adults. Programs that encourage family participation have better outcomes. Cost is often a significant concern, but there are options available. Many insurance plans, including Medicaid, cover some or all of the cost of treatment. Be sure to check with the treatment facility to see if they accept your insurance. Some facilities also offer sliding scale fees, financial assistance, or scholarships. And for those without insurance, nonprofit organizations or state-funded programs can be a great resource. Do you need help navigating all of these options? Safe Locator is a fantastic resource that can guide you through finding the right program. You can select various search criteria to get a list of programs to consider. You might still need to call the program to ensure that they're a good fit and that they have availability. You can visit safelocator.org for more information. If you're unsure what level of care your loved one needs, you're certainly not alone. It can be tough to determine whether outpatient counseling is enough or if more intensive residential program might be necessary. In these situations, the best step you can take is to get an evaluation from a professional. Look for an addiction healthcare provider, such as a licensed therapist, a psychologist, or a psychiatrist with experience in addiction treatment. They can perform a comprehensive evaluation, which might include assessing the person's physical health, mental health, substance use history, and any co-occurring mental health conditions. This evaluation is critical for creating a personalized treatment plan that addresses all aspects of a person's well-being. Choosing the right treatment program is a crucial step in the recovery journey. Remember, it's not about just finding any program. It's about finding the right program for your needs. Take your time, ask questions, and don't hesitate to seek help when you need it. If you or someone you love is struggling with substance use, know that there are many paths to recovery and you don't have to navigate them alone. Please reach out to us at drugfree.org if you need help developing a plan or if you just need someone to listen to what you're going through. Thanks so much for joining me today. For more information on this and other related topics, visit drugfree.org. Until next time, take care of yourselves and each other.